Hi, y'all, and welcome back to Professor Truelove's Concepts for Nurses series. We are in the Neurological series, Problems with the Brain, and in today's episode, we will tackle the concept of dementia, including Alzheimer's disease. Sources used for this podcast include Iggie's Medical Surgical Nursing, 9th edition, and Soul, Introduction to Critical Care Nursing, 7th edition. Dementia. Dementia is a chronic and progressive loss of brain function that affects the ability to learn new information. While symptoms of dementia can vary greatly, at least two of the following cognitive functions must be significantly impaired to be considered dementia: changes in memory, communication and language, attention span or ability to focus and pay attention, reasoning and judgment, and visual perception. Alzheimer's disease is the most common type of dementia, accounting for most of the chronic confusional states that occur in older adults, eventually causing complete disorientation, physical deterioration, and death, usually associated with the complications of immobility. Vascular dementia is the second most common dementia and is associated with stroke. Early onset dementia. When dementia occurs in people in their 40s and 50s, it is referred to as early dementia, Alzheimer-type disease, or presenile dementia. Difficulty with short-term memory is also a problem. Many dementias are progressive and result in a chronic confusional state. The most important risk factors are age, female gender, and family history. Nursing considerations for people with dementia. An important consideration is to recall that familial Alzheimer's disease has a genetic predisposition. The primary focus of the neurological assessment is to identify abnormalities in cognition, including language, personality, and behavior. Physical manifestations of neurological impairment, such as seizures, tremors, or ataxia, tend to occur later in the disease process. As the disease progresses, the patient may experience prosopagnosia, an inability to recognize oneself or other familiar faces. The priority for interdisciplinary care is safety, since chronic confusion and physical deficits place the patient at high risk for injury. Alterations in communication abilities include apraxia, that is, the inability to use words or objects correctly, aphasia, inabilities to speak or understand, anomia, the inability to find words, and agnosia, the loss of sensory comprehension. Observe patients with Alzheimer's disease closely because they tend to wander and make inappropriate decisions. Diagnostics that assist with the diagnosis of Alzheimer's disease include imaging from CAT scan or magnetic resonance, looking for normal or abnormal cerebrospinal fluid findings, electroencephalographic findings, and remember as a nurse to use precautions and preparations anytime you need to take the patient for one of these diagnostic exams. For patients with Alzheimer's disease, the newer drugs seem to improve function and cognition. For instance, cholinesterase inhibitors such as diazepam, or slow the disease process, such as when using memantine, but they do not cure the disease. Administer psychotropic drugs to patients with Alzheimer's disease who also have mental or behavioral health problems, such as depression or severe agitation. In other words, don't stop treating their underlying mental health abnormalities. When the patient and family receive the diagnosis, one or more family members may desire genetic testing. Support the patient's or family's decisions regarding testing and assist them in finding credible resources for testing and the appropriate level of genetics professional. Collaborate with the healthcare team in discharge planning and health teaching for patients who have chronic neurodegenerative disorders such as Alzheimer's disease. remind caregivers of patients with chronic neurological diseases, such as Alzheimer's disease, to find ways to cope with their stress in order to remain physically and psychologically healthy. Teach caregivers of patients with dementia to use validation therapy rather than reality orientation. Acknowledge the person's feelings and concerns. In other words, you kind of want to play along with the patient who is that confused because you're never going to be able to reorient them, and that would only cause stress to the caregiver and the patient. The patient is to have an established exercise program to maintain mobility for as long as possible, as well as to prevent complications of immobility. Involve patients and family in developing a continuing plan of care to meet expected outcomes and maintain quality of life. Adapt communication techniques for patients with dementia, and have patients and family identify community resources for patients with chronic brain disorders, including the Alzheimer's Foundation. That does conclude this episode of our Neurological series. As always, I am Gary Trullo. See you soon.